Hello, everyone. This is Steve D'Antonio from Whole Family Healthcare, here with Yo Adrian, our Director of Neurofeedback Services and creator of NEWROLOGIX. And we're going to be talking about all things related to brain health. A very important topic with schools starting up and all the multiple choices. But this is something that patients seek us out for. And Adrian and his company has been a tremendous resource for many individuals and families over the last decade working together. And so we're just here to, educate everybody about options that are out there. And, welcome, Adrian.
Thanks, Dr. D. I've had the pleasure of being in and around whole family healthcare for like the last decade, it seems like. So it's been quite a while. And your patient population and clients are they're the perfect fit for a multimodal approach to everything from brain health to the things that people come to you for, which are, things like attention issues, anxiety, depression, performance, both in sports and in corporate life. So we've been working together for a long time, and through this process, we kind of fine-tuned how NEWROLOGIX kind of evolved into this multifaceted approach that fits perfectly into your program, because I'm a big believer in supplementation and integrative health, and the different services that you guys offer in office along with the NEWROLOGIX, I think is just a perfect fit. So I think a lot of people just, you and I talked about doing this because it makes sense to kind of introduce people, to what the program is and how it works and how it incorporates to the offering. I think for your audience, I think it'd be germane and would make sense to kind of talk a little bit about what the brain mapping is first, what it looks like, the information we get back, and maybe dive into a little bit of the matches we find with the supplementation piece. So how do you feel about doing that?
That sounds great. And, to introduce it, there is a need. People don't want to take medications, or they want to try more natural strategies to identify what's going on, identify the cause. And to my knowledge, the brain map itself that you offer is one of the most precise and unique tools to, really give the patient insight of what's going on in their brain. And then one of the other things that you and I both are, been using is the urine neurotransmitter testing, which also can kind of show what the building blocks, what the body's creating in the gut, and how that translates into brain health and brain chemical production. Because once you start on medications, that starts altering physiology, and it just makes it a little more challenging to deal with. So we like to get people who haven't been on medication for more than 5 years, or who are really just trying to seek, natural options for optimizing their brain health. And the brain map, that's a great place to start. That's an awesome tool that you guys offer. So do you want to kind of dive in and kind of tell people what it's about?
Yeah. So basically, during the map recording, we take a cap that has 19 sensors built into it. And once we kind of get the sensors primed and prepped and ready, we get to look at brainwaves. And this is exactly what we see, what we look at when we're doing the recording. So you can see that, these are all different sensors located around the head that are strategically placed in what's called the International 1020 placement system. It's used by neurologists in hospitals and research and in clinical, modalities like sleep studies and things like that. So it's no different than the same sensor technology that's used for that. And this is really just a depiction of all the different parts of the brain that are firing simultaneously. They're sharing information, they're processing it all. And then the neat thing about our brain mapping system is that we can really create a three-dimensional model of the brain and look at it and look inside out. And the neat thing about that is that we can identify, kind of like on a weather map, hot spots, cold spots, areas of intensity, areas of low activation, areas of high activation. And this particular system, what's neat about it is that we can literally dive into the internal parts of the brain. So for example, this is the limbic region, which is the foundation of our emotional centers, and all that percolates up to the cortex, which is the thinking part of the brain. So in things like, anxiety and depression and ADD, we can look at the frontal lobe independently. in learning disorders and disabilities. We can look at reading comprehension processing problems in the occipital areas of the brain. We can look at language and speech processing areas. We can look at memory, facial recognition, and decoding. So all these things are things that are required for the brain to process not just reading information, but also emotional aspects of how the brain is interpreting the environment around us. And so once we have that information, we can take all of that, run it through a database system that provides us with a really neat report, which I'm going to pull up here. There it is. So the brain map report really is, it's an assessment. It's a quantitative EEG assessment. This is our sample report. So this is Mr. James Sample. But from the assessment, this is a very quick summary of what the brain map and the images provide us in this NEWROLOGIX report. We have things like cognitive efficiency, which we can highlight everything from the really major points like attention, verbal processing, visual processing, motivation, math comprehension, and memory. And then we can rate them with levels of probability. So one question or one thing I get asked a lot is red is bad, right? And the answer is no, red is just high probability. The evaluations are designed to look at the car, not the driver. So we're evaluating, the different components of the car and the working pieces. But one thing we can't do is evaluate how the person's using it. The CEC is something that we have a cognitive emotional checklist, which is it's a tool that we use to kind of get more of a subjective look at all these different symptoms and how people connect to those things. So the cognitive efficiency piece is fantastic for looking at emotional aspects. And then we look at, or cognitive aspects, and then we look at the emotional part of it. So we have things like focus, mood, and relaxation, and all the different proponents that are involved with how the brain is processing all this information that can cause things like impulsivity, distractibility, disorganization, all these things that contribute to focus and attention in a classroom. We have mood, which contributes to, things like anger, agitation, irritability. So when we're dealing with our patients that are dealing more with mood disorders or anxiety or things that really, they have unrest in their mind and can't seem to shut it off. I mean, these are the things that pop up. And obviously one of the biggest ones that we deal with is relaxation, which is the ability for the brain to calmly settle down, get away from this sympathetic nervous system mode, which sympathetic modes are high adrenaline, high anxiety, high tension, and more into a parasympathetic mode, which is when the brain and the body go into this homeostasis of just repair. And then once we have all this information, the database, what's nice about it is that it provides us with a supplement recommendation and protocol that we provide you specifically to put together an amazing supplement profile for the patient or the client so they can take home, and it's really customized to them. And this is all based off of research by University of Maryland that's tied into our database. That's really the brain mapping piece. So the supplement side, I'll let you talk a little bit about that and how that incorporates to overall wellness.
Yeah, thank you. The dashboards are very informative. Again, very unique information. And if I could back up just a couple steps, patients always ask, well, are they introducing electricity into my brain? And, is it painful to get the test done? Because they just hear brain testing and brain map, and they're like, they have to be educated a little bit. So can you comment on that?
Yeah, so this is, and thanks for bringing that up because I do get asked that a lot. This is not shock therapy. This is very passive, and by passive, I mean that we're listening to the brain. So the best example is kind of like these are, 19 different sensors that are listening to the brain, much like when you get an EKG done where they put sensors on your chest to listen to the impulses, the electrical impulses that the heart produces when it's pumping and firing and contracting the muscles. We're looking at the firing of individual or groups of brain cells that are producing electrical impulses. So we're just listening. We're taking the information. We turn it into numbers, which is why this is a quantitative EEG, different than an EEG where a neurologist will look at the waves and determine things like wave morphology. They'll look at spikes and waves. This is more of a quantitative or number analysis of the power, the intensity, the frequency of all the different brain waves and how they're produced and the different regions and locations they're in. and each area has a specific signature that it should be producing based off of the function of the brain. So if you have too much slowing or too much of the slow waves in the specific area of the brain, that's going to slow that part of the brain down. Too many fast waves, and it's going to really speed it up. So there's a really delicate balance that has to be in place in order for the brain to function appropriately. And then any deviation really up or down is what we like to evaluate and assess. And that's what we get from the brain map report, is really a deep dive and look at to what parts of the brain are overactive or underactive, and how that's creating an overall effect to the network of the brain, and how it's, you know, and evaluating and assessing the environment, if you will.
Great.
So I wanted to just kind of hear your perspective a little bit on some experiences that you've had, you know, and why people would be interested in this, why they would come to you, people that are currently seeing you that are looking for other solutions and things like that. So that way we can kind of cover a little bit of this now, just as an introduction. And in the coming weeks, as we get feedback from, you know, your clients and patients, we can kind of dive into specific topics and take requests on things like anxiety, depression, ADD, performance, and things like that. But give me some examples of why people would be interested in this, and then obviously some outcomes that we've had, because I think we've had quite a few outcomes over the years.
Oh yeah. Yeah, I think one of the sticking points, because whenever you talk about the brain, you know, sometimes it's just it's high level information. And when it was explained that there's a chemical and electrical part of the brain, and that when patients take medications over the years, you know, they address the chemical issues, and we address the chemical issues with diet and supplements. But the electrical components, if you stop taking the medications and you ever deal with the electrical components, I don't know anything that's as precise as neurofeedback that it can actually correct those imbalances. So, you know, talk about targeted focused therapy. You know, the NEWROLOGIX program with neurofeedback is very unique in that capacity. And so whenever you're trying to identify and treat the cause, when it's electrical like that, this is one of the best therapies for it. And I've been doing acupuncture over a decade, and there's certainly a subset of patients who really respond nicely for stress reduction, anxiety with the acupuncture. And I do know that the research shows that the acupuncture can impact the electrical system as well. But with the brain map information and the neurofeedback, you guys can be so much more precise. And so that is definitely something that I often refer for.
Yeah, and it's so complex, and when we talk about the electrical system and the network, I mean, when I do talks, for one of the first things that I throw out there is that the brain processes around 400 billion bits of information every 1 second, and you're only aware of around 2,000 out of 400 billion things that are going on. So any imbalance in that is really kind of how neurofeedback got started. This is 60 years ago, and I've been in the field for 22 years at this point, and I just have seen it evolve from, you know, just basic understanding of cortical structures in the brain and what they do, and now to very complex networks and how they're involved in everything from, you know, like we talked about, paying very close attention in a classroom environment, being super laser focused on a field or on the court. Those are all things that are super heavily involved in how the brain is distributing this information between front and back and left and right. So the brain map really does kind of dive into those key points. And then the neurofeedback, which, you know, in the next discussion, next time we do this, we can kind of dive into the neurofeedback and how that works, and then maybe cover that a little bit if you like.
Yeah, it sounds great. So, you know, we were referring back to the brain map report in the supplement section. So when it comes up with imbalances, we try to customize a plan for the patient. So we do look at additional things to, you know, kind of see where we're going to start with the patient. Because if they have tons of food sensitivities, it's going to create more interference in the brain and really makes Adrian's team's job a lot harder. And patients have to spend more of their resources to get better. So sometimes we'll do a stepwise approach. We'll identify food sensitivities, cut those out, give patients replacements for that, and work on, you know, restoring gut health, because, you know, what are the latest numbers as far as gut health and neurotransmitter production in the gut?
Yeah, I mean, it's like you're in some cases, some neurotransmitters, half of them are made in the gut. And that's an excellent point that, you know, we as neurofeedback providers, our biggest frustration is sometimes that we're fighting with different body systems because the brain is not in it's there's mutual exclusivity, but there's also not with the brain because it's tied in through this wonderful nervous system that is integrated with this enteric system that feeds information back from all the organs. And one of the things I learned from you was inflammation. Inflammation in the gut is not solely exclusive to the gut. I mean, the brain gets inflammation from, you know, from inflammatory markers that are elevated, and that is a big fight for us in neurofeedback and in our ability to regulate the brain. So really, my biggest interest and attraction and being part of Whole Family and becoming the director of neurofeedback here is because when we get stuck, we know that we have the ability to come to you or another provider in the office like Dr. Mueller and look at IV nutrition, or Dr. Logan and look at hormones, or you know, do acupuncture, because this system, you know, is not, it's affected, but it's also regulated by the brain. And if we can address the brain, the mind, and the body, which is what we all know now, it's the new way of looking at medicine and in its integrative approach, that it's not targeted and focused on just one thing. It's the whole body and the brain included. That really makes this program outstanding for us and has increased our success rate. So you know, on a personal note, I want to thank you because you sometimes make me look like a rock star when we have families that we're working with and we get stuck and we can just refer them in office directly to you to help look at these imbalances that are happening in the gut. So it's a good combination. I'm always happy when we can, you know, team up and work together on a patient.
Yeah, that compliment goes right back to you, buddy. A lot of times you guys provide, you know, just significant life change for individuals and families that we wouldn't be able to accomplish with just supplements and dietary changes. So yeah, I appreciate you too. You know, the best way that I can describe the gut-brain connection, because some people still don't understand. They're like, well, they're not even, you know, I don't even understand the connection. Well, the actual digestive tract has receptor sites or docking sites where these neurotransmitters saturate these receptors. Mm-hmm. And so, for example, if you have depression and they start you out on an antidepressant medication, they usually tell you it's going to take a couple weeks before you're going to notice any improvements, because that medication has to saturate or fill up all those receptor sites in your digestive tract first before it'll start being in sufficient quantities where it'll actually cross the blood-brain barrier and start impacting, you know, the brain physiology. So when you're dealing long-term and treating the cause, digestive issues can significantly improve brain health, and we've seen that over and over.
It's like a catchphrase now when you hear about the digestive system being the second brain. I mean, it's now, you know, like you said, there's actual neurons and there's actual brain or intestinal intelligence is what a lot of people are kind of talking about. And so we could talk about this all day. I think I'd like to kind of wrap up and give people a little bit of information about contacting the office if they need additional information. We're going to send out some information on, you know, future discussions and topics. So I'll let you kind of wrap up with that, and then you know, we'll reconvene.
Awesome. Yeah, we've got a team that's able to answer questions over the phone. We've put additional information on our website, and with Adrian's help, we've been continuing to add more video content because when we're talking about the brain, it's challenging to kind of describe to a patient over the phone. And so Adrian's created some interactive videos that kind of explain the ins and outs of what the brain map is, what it can tell us, and then what the NEWROLOGIX program is. So all that's on our website, wholefamilyhealthcare.com. And if you'd like to speak to somebody in person, please call the office 407-644-2990. We'll be happy to get you plugged in and let you know what your options are as far as, you know, brain health to assess it, and also treatment strategies to, you know, maximize the output of your brain.
And you guys have done an amazing job with the website. It looks phenomenal. And just this list of services that are, I don't know of any other facility in Orlando that has this targeted, amount of just amazing services. So under the Whole Family Healthcare website, on the wholefamilyhealthcare.com, under medical services, if you have additional questions or interest on the different programs involved with NEWROLOGIX under brain mapping and neurofeedback, simply click there and you'll find this neat little page that has different programs entitled Education Athletics, our Align program, which is our 55 plus for memory, function and things like that kind of tend to drop off a little bit after 55 years plus. You can click on any of those there and it'll direct you to a little bit more information, or like Dr. D said, we'll reach out to the office and we'll get you connected. And I'm super excited to meet and greet new people and even talk about neurofeedback and brain mapping. As you can see, I love talking about it. So I appreciate this opportunity to talk to your patient base.
Appreciate you, buddy. You have a good day.
All right. Thank you so much. We'll talk soon.
All right. Bye-bye.